Hi, I am Dr Sapna, fertility consultant at Iswarya Fertility, HSR Layout, Bengaluru. Today I will be dealing on the small topic, that is the low AMH. When a couple comes for an evaluation of infertility, we see about 20 to 30% of the female fertility problems are related to the poor ovarian reserve or the low ovarian reserve. When we tell it is about the low ovarian reserve or the poor ovarian reserve, it is evaluated by a baseline scan wherein we see the antral follicle count and by the AMH. Any patient with a low ovarian reserve should not be pulled on with the natural and IUI procedures for a prolonged time. We should vigorously treat the treatment and give the treatment option so that the conception is possible and with their own genetics. Many patients have the misconception that with the low ovarian reserve, the quality of the eggs and the quantity of the eggs are less and they require donor. But it's a myth. Poor ovarian reserve can always be treated by various technologies like IVF, ICSI. The major technology involved in treating these patients is the embryo pooling, wherein we stimulate the patients. We do the egg pickup. When we do the egg pickup, once the embryos are formed, we require minimum of 3 to 4 embryos to give a very good 70% result. To do that, we can always give the option of embryo pooling, wherein the stimulation of the patients required maybe once or twice. But what exactly we can do in low ovarian reserve patients is we should first evaluate them. We should start with the antioxidants. We should start with the anti-DHEA tablets and all other micronutrients evaluation, and then start at the earliest for the stimulation of the patients to maximize the eggs pickup and the embryo formation. Once we get 3 to 4 good embryos, we can proceed for the good embryo transfer. The success rate of a patient with a low ovarian reserve is always comparable with the patient with a normal IVF, wherein the success achieved will be about 80%. Extra technology what we do in low ovarian reserve is giving the antioxidants, giving the dietary supplements before the start of IVF, and doing the egg pickup stimulation twice during one cycle, or it may be 2 simultaneous stimulations to collect the eggs so that the embryos can be got adequately for the transfer. Patients requiring donor embryos in a low ovarian reserve is always a myth. It is not the fact. So at Iswarya, we have higher technologies like ICSI, IMSI and PICSI, wherein the quality and the quantity of embryos can be more and the success rate can also be more.